At 11:47 on a rainy Tuesday night, your dog is standing in the hallway, lifting one front paw and refusing to put it down. You hear the tiny click of a nail hitting the floor as he takes one nervous step, then another. Earlier that evening, you decided his nails were getting too long, so you grabbed the clippers, held his paw tightly, and made what looked like one quick, harmless cut. Now there is a small smear of blood on the tile. Your dog is licking the same toe over and over, and you are staring at the clippers wondering how something so simple went so wrong. You think the problem was that you did not trim enough. But sometimes the problem is not the length of the nail at all. What if the thing you are reaching for next is exactly what your dog's paw needs you to put down? Hi everyone, I'm Dr. Ryan Scott, your neighborhood veterinarian. Long nails are one of those everyday dog care problems that seem simple until a dog becomes frightened, a nail starts bleeding, or repeated trimming turns into a wrestling match. Today we're going to slow this whole process down and look at what is actually happening inside a dog's nail, how you can assess the nail safely at home, why aggressive clipping can backfire, and what you can do instead. And if practical, evidence-based dog care guidance like this helps you feel more confident at home, consider subscribing so you have a trusted resource to come back to. Let's start with the part most people never see. A dog's nail is not just a hard little shell that you can cut wherever you want. Inside the nail is living tissue containing blood vessels and nerves, commonly called the quick. The hard outer portion grows around and beyond that living core. Think of the nail like a tiny protective tunnel built around a sensitive cable. The farther the nail grows, the more difficult it can become to remove a large amount at once without getting close to that sensitive tissue. And the shape of the quick can change with nail length, so simply deciding that a nail looks too long does not tell you exactly where the safe cutting point is. That is especially important with dogs whose nails have been allowed to grow long for a while. As the nail remains long, the living portion can extend farther toward the tip. Regular, conservative trimming can gradually help maintain a shorter nail, but it is not safe to assume you can take a large amount off in one session. When the nail touches the ground or becomes visibly hooked, it can also alter the way the toe contacts the floor. That does not mean every long nail automatically causes a serious orthopedic problem, but persistent overgrowth can contribute to discomfort and changes in normal paw mechanics. Now let's do a simple home assessment before you touch the clippers. Put your dog somewhere calm with good lighting. Let him stand naturally, then look at each paw from the side. Are the nails clearly contacting the floor when he stands? Are they sharply hooked, splitting, or curling around toward the paw? Then gently pick up one paw and look at the nail without squeezing the toe. Watch your dog's body language. A relaxed dog may leave the paw loose, while a dog that pulls away, freezes, pants, trembles, growls, or repeatedly licks the paw is telling you that this is not a good moment to continue. Here is an important correction to a common assumption. You do not need to make every nail extremely short to be doing a good job. The goal is routine maintenance without cutting into living tissue or turning nail care into a fear experience. If your dog has clear or pale nails, you may be able to see the pinkish quick inside. With dark nails, the quick may be much harder to visualize, and you should assume the safe margin is smaller rather than trying to guess by taking a large bite. Now we need to talk about the dangerous common mistake. It is the instinct to make one dramatic cut and get it over with. You hold the paw firmly, place the clipper far up the nail, and squeeze quickly, because you believe one big trim will solve the problem. The trouble is that you cannot reliably judge the exact location of living tissue from the outside, especially in dark nails. If you cut into the quick, the nail can bleed, and the dog can experience pain. After that painful event, some dogs become more resistant to future handling, which can make every subsequent nail session harder. There is another mistake that often follows: continuing to clip after the nail has started bleeding because you want to finish the other nails while you have the dog restrained. Don't do that. A frightened or painful dog can suddenly pull the paw away, and that movement can make the next cut less controlled. More importantly, forcing the session can teach the dog that paw handling predicts pain and restraint. In a dog that is already nervous, the behavioral consequence can outlast the original nail problem. So what should you do instead? Think small, calm, and repeatable. First, let your dog see and sniff the nail tool without using it. Reward calm behavior with a small treat. On another short session, touch the tool to the paw, then reward. Next, hold one toe gently for a second and release. If your dog remains relaxed, reward again. You are using counter-conditioning and gradual desensitization, pairing a previously worrying experience with something positive, and increasing exposure only while the dog remains comfortable. This is not a magic trick, and it does not have to happen in one day. For some dogs, it takes several sessions. When you are ready to trim, choose a quiet time when your dog is naturally settled. Use a properly sized dog nail clipper or a dog-specific nail grinder, and remove only a small sliver from the tip. With pale nails, stay well away from the visible quick. With dark nails, make tiny cuts and inspect the freshly exposed surface after each one. As you approach the quick, the center can change in appearance, but this is not a guarantee, so conservative trimming is still important. Stop before your dog becomes distressed. 1 or 2 nails done calmly can be a better training session than all 4 paws completed through a struggle. The first tier is simple maintenance. If the nails are only mildly overgrown and your dog is comfortable, trim a very small amount every few days or as needed, rather than waiting for a large amount of growth and attempting a major cut. There is no universal number of days that fits every dog, because nail growth and activity vary. A useful practical goal is to inspect the nails regularly and maintain them before they become dramatically long. Safety rule: never make a large cut just because the nail appears long. Remove only a conservative amount that leaves a clear margin from the living tissue. The second tier is the walking and surface approach. Normal walking on firm surfaces can naturally wear some nails, although it varies greatly between dogs, and should not be treated as a substitute for inspection and trimming. If your dog already enjoys regular walks, keeping that routine can help with natural wear. It may be especially useful to pay attention to dogs that spend most of their time on soft ground, carpets, or indoor flooring, where there may be less abrasion. Safety rule: do not deliberately force extra long walks on hard or abrasive surfaces to file down nails, especially if your dog is already limping or showing paw discomfort. The third tier is the grinder approach, for owners who struggle with traditional clippers. A dog nail grinder removes a small amount of nail gradually, which can make it easier to work conservatively. Introduce the sound and vibration separately before bringing the tool near the nail. Let your dog hear it from a distance. Reward calm behavior, then gradually decrease the distance over several sessions. When grinding, use brief contacts rather than holding the spinning surface against the nail continuously. Safety rule: do not press a grinder against one spot for a long time, because friction generates heat and can injure the nail or surrounding tissue. The fourth tier is for dogs whose nails are already significantly overgrown, tightly curled, painful, or difficult to handle. This is where the smartest home care decision may actually be to stop trying to solve the whole problem yourself. A veterinarian or qualified veterinary professional can examine the paws, determine whether the nail shape is causing injury, and create a gradual trimming plan. In very fearful dogs, a veterinary team can also discuss humane handling and, when medically appropriate, medication or sedation to prevent a dangerous struggle. Safety rule: if a nail has grown into or is pressing into the paw pad, do not try to dig it out or cut deeply at home. Now for my favorite low-cost trick. Use your phone flashlight as a viewing aid for dark nails. Hold the light behind or beside the nail in a dim room and see whether the internal structures become easier to distinguish. It does not magically make every dark nail transparent, and you should never treat the flashlight as proof that a particular cut is safe. But for some nails, better illumination gives you a clearer view of the shape and helps you decide where to make a tiny conservative trim. If the quick still cannot be distinguished, stop guessing and take off less rather than more. There is also a behavioral version of this trick that many owners underestimate. Instead of teaching your dog that nail time means hold still until this is over, teach him that he can succeed by offering tiny pieces of cooperation. Touch paw, reward. Hold toe, reward. Show grinder, reward. Brief contact, reward. Then stop while the dog is still doing well. This gives you more opportunities to build a calm response without needing a dramatic session. If your dog repeatedly pulls away, becomes rigid, growls, snaps, or cannot take treats because he is too frightened, that is not stubbornness you need to overpower. It is information that the step is too difficult. And remember, the nail itself is not the only thing worth checking. Look between the toes for obvious debris, swelling, redness, cuts, or a foreign object. Check the paw pads for cracks or injuries. Compare one foot with the others. If your dog suddenly starts licking one toe when he previously tolerated nail handling, the nail may not be the only issue. A broken nail, inflamed nail bed, foreign body, skin disease, or other painful condition can make a normally cooperative dog resist. Let's move to the point where home care stops and a veterinary visit becomes mandatory. Stop trimming and seek professional care promptly if the nail is bleeding heavily or continues bleeding despite steady pressure. If the nail is split or hanging and your dog is painful, if a nail has penetrated the paw pad, if there is marked swelling, pus, foul odor, or increasing redness around the nail, or if your dog suddenly cannot bear weight on the leg. You should also arrange a veterinary examination if your dog repeatedly develops broken nails, has persistent pain in one toe, or shows a major change in gait. And if your dog becomes aggressive because of pain or fear during nail care, do not attempt to overpower him. Why these signs matter is simple. A veterinarian can examine the nail and surrounding tissue closely, determine whether the quick or nail bed is injured, look for infection or a foreign body, and decide whether pain control, prescription treatment, bandaging, or a more controlled procedure is needed. Some damaged nails need the unstable portion removed, but that decision depends on the injury and should not be improvised with household tools. In severe cases, a veterinary team may use sedation or other controlled handling so the paw can be examined and treated without turning the experience into a traumatic struggle. So let's bring the whole lesson together. Your dog's nail is living tissue wrapped in a hard outer structure, not a piece of plastic that can be cut anywhere. The safest strategy is not one giant trim. It is regular inspection, tiny conservative reductions, calm handling, and gradual training. If walking naturally wears some nail, great. If a grinder makes small controlled reductions easier, that can be useful. And if the nails are badly overgrown or your dog is painful or terrified, professional help is not a failure. It is the responsible next step. If you have ever heard that sharp little click of your dog's nails on the floor and wondered whether they were too long, I want you to tell me one specific thing in the comments. Were the nails clear or dark, and did your dog ever pull the paw away the moment you brought out the clippers? I read every single comment, and those details can help other owners recognize that they are not the only ones struggling with this. If this video helped you understand why just cut more is not the safest strategy, give it a like and share it with another dog owner who may be trying to handle nail care at home. And subscribe if you want more calm, practical veterinary guidance that helps you know what you can safely do yourself and when it is time to call the clinic. I'm Dr. Ryan Scott, your neighborhood veterinarian. Stay safe, keep those paws comfortable, and I'll see you in the next one.